Yes, in this video, let us look at the causes of intestinal obstruction. So, first of all, you yourself will say, what are the causes of intestinal obstruction? There is something in the lumen, right? Something can be there in the lumen. What? It could be a gallstone. There could be a gallstone. So, all the stone from the gallbladder came and it's sitting here, gallstone. So, especially if it sits in the ileum, so it becomes gallstone ileus, okay? So, gallstone ileus. They have put this first, so you can learn gallstone ileus. Then, food bolus obstruction. Food bolus obstruction itself. So, have they marked it here in this diagram? Food bolus itself is the obstruction. Okay, then round worms. So, here a lot of worms we have to draw now. So, there could be round worms which are obstructing. Round worms means what? Ascaris lumbricoids. Okay, then we have finished this. Gallstone, we saw food bolus, roundworm, then foreign body. How will foreign body escape everything and reach the intestine? Okay, meconium ileus. So, meconium plug, etc. is there, right? Where meconium is the first fecal matter that the baby sends. Okay, so that could become the obstruction. Okay, so we have done the lumen. Whatever can be in the lumen, we have completed. Now, in the wall of the gut, that means this gut is there, right? The wall. Okay, here what can be there? Strictures because of tuberculosis, Crohn's disease. You have seen skip lesions will be then Crohn's disease, right? Carcinoma. So here they have shown carcinoma of the splenic flexure. Here they have shown the carcinoma of the hepatic flexure. Okay. So hepatic flexure, splenic flexure, carcinoma they have indicated here. Atresia. So it has kind of atresia meaning what? What do you mean by atresia? This is absence or abnormal narrowing of the opening of the passage. So, have they marked in this photo any atresia? Can you see any atresia here? Okay, they didn't show any atresia here. Okay, fine. So, we're done with this. Then adhesions. So, a lot of adhesions they have shown here. You can see if it is stuck up like this and there are adhesions, then how will it undergo peristalsis, right? So, there will be obstruction. Very good. Now, let us go to the outside the wall. Outside the wall of gut. From something outside, something is there. Okay, what? Volvulus. See, like a sigmoid volvulus, it will just turn around, twist around itself. Intussusception. Intussusception, usually the ileocecal. So, what will happen? The ileum will go off into the cecum. So, like a telescope. The small, the proximal one will go off into the distal one. That is a intussusception. Then congenital bands. So, have they shown here any congenital band? Did you see here? Okay, they have not shown. Then Meckel's diverticulum with band. Have they indicated that here? Here, they have shown Meckel's diverticulum. See here. So, there's a diverticulum, right? They are showing here Meckel's diverticulum, okay, with band. There's a band also, okay. Then, obstructed hernia. Here, they are showing you that there is a hernia. It is coming out of the ring. Can you see the ring? Let's go down here. Can you see there's a ring here? And from the ring, it's coming out. So, let's assume this is the superficial ring. So, the bowel is coming out. So, it can become obstructed and ischemic and necrotic, etc. So, that is another cause of intestinal obstruction. So, these are some causes of intestinal obstruction. Here, they have also shown rectosigmoid carcinoma. So, here they have marked rectosigmoid carcinoma. They have shown fecoliths. So, just not renal stones or gallstones, even fecal stones. Fecoliths they have shown here. Then, have we covered everything? Yeah, I think we have covered everything. Okay. So, basically, malignancy could be a cause. So many causes can be there for intestinal obstruction. So, many other ways of telling about intestinal obstruction causes are that what you saw now, mostly dynamic, mechanical causes, right? There is something like adynamic, that is paralytic or neurogenic because of the nerves, okay? Post-surgery, maybe the nerves stopped working, right? Parasympathetic nerves stopped working and there could be a paralytic ileus, actually that's called as ileus. Or there could be Hirschsprung disease. Hirschsprung disease is where there is congenital megacolon, where there is absence of the nerves itself, right? So that could be Hirschsprung disease. This could also be unacquired megacolon. There is something called as a pseudo-obstruction. Again, pseudo-obstruction is where there is malfunctioning of the parasympathetic nerves, okay? Malfunctioning of these nerves, sacral parasympathetic nerves. There is no mechanical obstruction as such in the pseudo-obstruction. It will result in the atony of the descending colon, okay? Something to do with the nerves, okay? So, so these are again the causes. Now, some terminologies you can learn here. What is mechanical obstruction? You know, paralytic ileus is because of the nerve. There is no physical barrier. There could be something called as a closed loop obstruction. See, if the obstruction is here, it is kind of one-sided, but on both proximal and distal, if it is obstructed, it is a closed loop obstruction. Okay, so these are some other terminologies you can learn. So just see if you have understood all the causes of obstruction of the ileum, of the colon, of the etc. Ileum is more like the distal part of small intestine and colon is the large intestine. So I think we have covered everything. Mesenteric ischemia could be a cause. That is something new, right? Mesenteric ischemia. Anorectal malformations, right, can be a cause of obstruction. Stricture colon is rare. Everything else we have covered, right? So mostly all causes of intestinal obstruction we have covered. So just a few more words if you want to know. There is something called a simple obstruction and strangulated obstruction. Simple obstruction is referring to the lumen, the early ones. Then once there is impairment of blood supply, it becomes strangulated. Okay. And there can be, you can call it as acute obstruction, chronic obstruction, acute on chronic obstruction, right? A lot of terminologies there. So hope you have understood the main causes of intestinal obstruction. So mechanical and the others are non-mechanical. Okay.